Agidoxin Information. Agidoxin is a medication that contains pyridoxine hydrochloride at a dosage of 250 mg. It is indicated for the treatment of vitamin B6 deficiency. Safe use of medication. Agidoxin is a medication that contains pyridoxine hydrochloride at a dosage of 250 mg. It is indicated for the treatment of vitamin B6 deficiency. 1. What is agidoxin? Agidoxin pyridoxine is a form of vitamin B6, which plays an important role in many bodily functions, including metabolism of proteins, carbohydrates, and lipids. Vitamin B6 is a coenzyme required for over 100 enzyme reactions related to the metabolism of these nutrients. 1. What is agidoxin? Red blood cell formation. Vitamin B6 is involved in the synthesis of hemoglobin, the main component of red blood cells, which helps transport oxygen to tissues in the body. 1. What is agidoxin? Nervous system function. Vitamin B6 plays a role in the production of neurotransmitters such as dopamine, serotonin, and norepinephrine, which are important in regulating mood, sleep, focus, and memory. Immune support. Vitamin B6 helps boost the immune system, helping the body fight off pathogens. 2. Mechanism of action of agidoxin. Agidoxin is easily absorbed through the gastrointestinal tract. Pyridoxine absorption may be reduced in people with malabsorption syndromes or gastrectomy. Normal plasma pyridoxine levels range from 30 ng/ml to 80 ng/ml. 2. Mechanism of action of agidoxin. After taking agidoxin, most of the drug is stored in the liver, with the rest in the muscles and brain. The main forms of vitamin B6 circulating in the blood are pyridoxal and pyridoxal phosphate, which have a high affinity for protein. Pyridoxal crosses the placenta and enters breast milk, with fetal pyridoxal plasma concentrations being 5 times higher in maternal plasma. 2. Mechanism of action of agidoxin in red blood cells. Pyridoxine is converted into pyridoxal phosphate, while pyridoxamine is converted into pyridoxamine phosphate. In the liver, pyridoxine is phosphorylated into pyridoxine phosphate, transaminated into pyridoxamine phosphate. 3. Uses of agidoxin. Agidoxin is indicated for the treatment of vitamin B6 deficiency, including vitamin B6 deficiency due to dietary deficiency. Vegetarians, heavy alcohol drinkers, people with liver disease, kidney disease, celiac disease, are often at risk of vitamin B6 deficiency. 3. Uses of agidoxin. Vitamin B6 deficiency due to pathology. Some pathologies such as sickle cell anemia, multiple myeloma, pernicious anemia, can lead to vitamin B6 deficiency. 3. Uses of agidoxin. Vitamin B6 deficiency due to drug use. Some medications such as isoniazid used to treat tuberculosis, cycloserine used to treat tuberculosis, hydralazine used to treat high blood pressure, can reduce the amount of vitamin B6 in the body. 3. Uses of agidoxin. Vitamin B6 deficiency due to pregnancy. Pregnant women need to supplement with vitamin B6 to meet the increased needs of both mother and fetus. 3. Uses of agidoxin. Vitamin B6 deficiency due to breastfeeding. Breastfeeding women also need to supplement with vitamin B6 to ensure sufficient and high-quality milk production. 4. Dosage and administration of agidoxin. The dosage of agidoxin will be determined by the doctor depending on the patient's health status. Typically, the adult dosage is 250 mg/day, divided into 12 doses. 5. Side effects of agidoxin. Agidoxin is generally well tolerated. Common side effects include gastrointestinal disorders, nausea, vomiting, diarrhea, abdominal pain. Neurological disorders, dizziness, headache, fatigue, insomnia. 6. Precautions when using agidoxin. Do not use agidoxin if you are allergic to any of the ingredients in the medication. Use agidoxin with caution in patients with liver disease or kidney disease. Use agidoxin with caution in pregnant women and breastfeeding women. Do not use agidoxin in children under 6 years of age. 6. Precautions when using agidoxin. Do not change the dosage or stop using agidoxin without your doctor's consent. 7. Storage of agidoxin. Store agidoxin at room temperature in a dry, cool place, away from direct sunlight. 8. Consult a doctor. Please consult your doctor or pharmacist before using Agidoxin. Note this information is for informational purposes only and is not a substitute for professional medical advice. Please contact your doctor or pharmacist for specific advice on your health condition.